Dear Chair, thank you very much. So we're now moving on to From Bench to Bedside, reflecting our clinical experience with aflibercept 8 milligrams in diabetic macular edema. And myself, Michael, and Tim will be sharing some cases and discussing them. Please note our financial disclosures. So I was really delighted that we're having a cricket theme here. And the cricket theme is that I'm going to be the opening batsman, perhaps Sachin Tendulkar, who knows? Michael is going to be the all-rounder, and Tim is going to be the finisher. And we are going to discuss cases, and we'll let you decide which one is the winner out of the case. Of course, this is not a competition. So, I'm going to talk about a case which I think underlines the importance of the 8 milligram molecule in the ability to gain anatomical control when switching to that therapy from other therapies. And I'm going to discuss a 63-year-old male with mild non-proliferative diabetic macular edema who was previously treated with diabetic macula for 4 years. A very tricky case to treat that I'm sure we're all familiar. So these are the images on the right-hand side, the Optos images of an individual with mild non-proliferative diabetic retinopathy. In the past, the reference central retinal thickness stability was 293 and 259 microns respectively in the left and right eye. And this individual had multiple treatments, all with very good agents, but all perhaps not performing as well as we would like. So individually, the individual had fluocinolone acetate, had aflibercept 2 milligrams, and dexamethasone implants, as well as faricimab. The dexamethasone implant, unfortunately, had a relapse of the diabetic macular edema at 13 weeks, so the durability wasn't as we would expect. The fluocinolone acetate implant, unfortunately, gave an insufficient anatomical and visual result. Now, all medications, as mentioned, can cause intraocular inflammation, and there was mild inflammation due to faricimab, and our particular policy, if that occurs, is to move away from that medication afterwards. Of note, there was past cataract uveitis. So, the individual was on 4 weekly 2 milligrams, and these are the central retinal thickness maps and cross-sectional OCTs, and you can see residual central retinal thickness with a central retinal thickness of 462 on the left and 329 on the right. So I'm going to ask you, what would you do next? Would you continue aflibercept 2 milligrams, start aflibercept 8 milligrams, perhaps an alternative therapy such as macular laser, or other? Well, as 8 milligrams, an alternative, an additional therapy and an armamentarium became available, we started this medication. And this is the result after a single injection. So we see a reduction of the central retinal thickness to 323 microns with a gain in visual acuity. And I feel this reflects what we were seeing in the PHOTON study. Remember, the PHOTON study had previously treated patients. So I hope you're going to vote as this as the most successful case. Thank you very much.